It is not unusual for anyone diagnosed with oral cancer to be very scared initially. Nobody is ready for this. So if you have been diagnosed with oral cancer and you're going through thoughts like, will I live? Will I, be able to endure the treatment? Will the disease come back? How will my family cope with all this? You are not alone. So as a psychiatrist working in a cancer hospital, I would say that, these anxieties usually settle down after the first few days because, you are in a system and you are being, undergoing the tests and your doctor would be discussing the treatment options. Good news is that oral cancer in the early stages is completely curable. The patients who come for treatment for oral cancer, many of them cope very well. Occasionally, there might be patients who are sleepless. They're so worried about their treatment that impacts on their day-to-day life. In that situation, I would say try to stick to the normal lifestyle which you have, going for a walk or, doing your day-to-day activities as much as possible. Sometimes enjoying your hobbies like listening to music and other things also help. Now, if these don't work and you're still worried, it might be an idea to see a mental health professional like ourselves. We might be able to direct you to a psychologist who would address your anxieties through talking treatments, or occasionally you might require a small dose of medications for a short period of time to help with the anxieties. You need to understand the difference between normal anxiety and sadness with a clinical syndrome of depression, which is an illness. Now, in depression, what happens? You might feel low, you feel tired, you don't feel like enjoying things which you used to like previously. You might have reduced sleep or increased sleep occasionally, poor appetite. And if these symptoms continue for more than 2 weeks, we call it a syndrome of depression. Depression is completely curable and it's common. So in this situation, it's important that you consider seeing a psychiatrist or a psychologist so that this is adequately addressed. It's not unusual for patients with oral cancer to have a history of, using substances like tobacco or alcohol. Please don't feel upset about this at the stage when you're being diagnosed with cancer, and be open with your doctor regarding this, because if you stop the substances and this is adequately treated, you would be having a smooth pre- and post-operative period. Of course, you need to stop the substance use forever. You should not get back to it ever. Patients are worried. At the same time, family members are anxious as well, because this requires treatment for quite some time. During radiation treatment, you might think, you might be worried about pain. You would share about that from our colleagues who treat oral cancers with radiation and chemotherapy. But good news is that, these treatments also end at a time. Now, you have to slowly get back to the life that you were in. Some patients find it difficult that, they are worried that will the cancer come back, which we call is like fear of recurrence. So I think, at this stage, when you have been treated with surgery, the intention of treatment is cure. So once the treatment is over, you should think of yourself as somebody who is better. You need regular follow-up in the hospital. Nevertheless, get back to life as much as possible. Hopefully, your journey with some ups and downs, you will be able to, complete the treatment and get back to life as much as possible with completion of treatment.